Hey, have you seen? Mr. Beast has a new video where he, drumroll please, cures blindness. Okay, he doesn't actually do it himself, but he does pay for 1,000 people, mostly in America by the way, to get cataract surgery to clear their vision. And this video didn't get the universal, "Aw, isn't that nice" reaction. No. Many on Twitter railed against the idea that in America, a celebrity YouTuber had to give away the gift of sight. Now, I understand the anger. After all, Mr. Beast most likely didn't go into his own pocket to bless these people. And it does feel kind of gross that these people's desperation is being put on camera. But then again, they needed the surgery, and he did make it happen. After all that's being said, the criticism is misplaced. The real issue is why he even had a chance to do this video, let alone in one of the richest countries on the planet. And to be fair, even he recognizes something is wrong. But actually, there are countries who have figured out how to provide healthcare to their people, and not just the Scandinavian ones. Now, when we say free, we know that most of these countries are paying for universal healthcare through taxes. But for those who are unable to pay, it doesn't cost a dime, and no one goes without. So in this video, we're covering it all when it comes to free healthcare around the world. We talk about the largest system, the most improved, the oldest, and the most stretched for resources. And at the end, we'll count down to the best in the world. And yes, the best is free and universal. When we're done, there'll be no more excuses for America not getting itself together. Number 5, the largest universal healthcare system in the world, Australia. Australia has the largest system because it's the only continent to provide universal coverage. And despite being the 6th largest country in the world, it covers everyone. And I do mean everyone. That's right. Citizens, permanent residents, temporary visa holders, visiting students, and even asylum seekers all get access to mostly free healthcare. Although they do have both a private and public system, the public one does a great job of covering most things, including offering free medical services and prescription drugs. Ironically, it's called Medicare, but unlike in the States, you don't have to be a senior to qualify. 75 to 100% of your medical costs are covered, and that percentage is based on income. And even that has a cap of 2,000 Australian dollars per year, so no one is asked to pay too much. Another unique feature of the system is that doctors can charge what they want, but the government does encourage them to keep costs low. And they have a pay-for-performance plan to encourage good health outcomes. It's a bit complicated with the non-profit and the for-profit healthcare providers, but overall they get the job done. And even though they've been criticized for the health outcomes of their indigenous populations, nobody is left needing charity to access care. So if you're ever in Australia and you need to see the doctor, don't worry, they got you covered. Number 4, the most improved free system in the world, Taiwan. Oh boy, picking the country that's come the farthest in offering universal healthcare was like choosing a favorite child. But the winner was Taiwan. Why Taiwan, you ask? Well, it's because their system is the closest thing to what we've got going on in America. Okay, picture this. 25 years ago, Taiwan was in the same healthcare boat as America today. They had a system that covered workers through their jobs, and if you got sick, you had to cough up some serious cash. But in 1995, Taiwan decided to get their healthcare act together. They did some research, took a peek at what other countries were doing, and landed on a single-payer system like France's instead of the government-run program like Britain's. Most of their hospitals are privately owned, but are non-profit, and their doctors are a mix of salaried and self-employed. Their system covers inpatient and outpatient care, dental, and even Chinese medicine. It's way better than even Medicare in the States, with short wait times and no referrals necessary. And the best part? The premiums are based on income, so the rich folks pay more than the rest, and those without pay nothing. Taiwan's healthcare is a model for doing a lot with a little. And get this, they did it all without breaking the bank. They're about the same size as my home state of Maryland. That still doesn't have universal coverage. It took Taiwan 5 years of planning and 2 years of legislation to get it done. How long has America been debating healthcare again? So I say, America, let's take some lessons from Taiwan. It can be done, even in the modern age and with smaller budgets. Number 3, the oldest universal healthcare system, Germany. Germany takes the prize for having the world's oldest universal healthcare system, which started in the late 1800s. And get this, the whole time, they've managed to cover 100% of Germans through both private and public insurance. There, you can see any doctor you want, and the insurance companies can't set limits. Everyone in Germany must, and I do mean must, have health insurance. But there are only 2 options. One is called SHI, or the other called PHI. If you make over $60,000 or are self-employed, you're eligible for PHI, while everyone else pays taxes into SHI. The SHI system is highly regulated, so there's no lifetime caps or pre-existing condition nonsense, and they can't charge crazy prices. And even though they're nonprofits, SHI providers still compete for customers, so patients have lots of options with over 110 different what they call sickness funds. Believe it or not, many Germans who qualify for PHI still prefer to stay with SHI because private insurance costs are age-based. That means if you choose private insurance when you're younger, you may not be able to afford it when you get older, and it's hard to change back. Plus, dependents are free on SHI, so that's also a plus. Even though it's a little bit complicated for my liking, Germany manages to cover everyone. So again, the underemployed, unemployed, disabled, or elderly do not go without. Number 2, the most stretched thin, Cuba. When people think of universal and free healthcare, this country often gets left off the list, probably for political reasons. But it really shouldn't be. Every single person in Cuba can get the healthcare they need, and it's all focused on keeping people healthy rather than just treating them when they're sick. Its system is much less than the US, like we're talking 8 times cheaper per person. So it gets the award for being the most stretched thin because it does all of this despite pretty serious sanctions from the US of A. So how do they do it? Well, first of all, they've got doctors and clinics in every single community. And the doctors don't just sit around waiting for people to come to them. No, they go out into the streets to treat patients as well. How nice, not having to trek out to see a doctor when you're sick. Another secret to their success is that doctors in Cuba get free medical training. So no student debt for them. This training is also free for doctors from other countries, which means they're helping to take care of the sick all around the world. They've got a doctor for every 150 people in Cuba, which is way better than the ratio in the States, 1 for every 300. And while haters will say it's not quality care, all this adds up to a life expectancy of 79, which is higher than our 77. Even the United Nations thinks they're doing a great job. They've commended Cuba's healthcare system as a model for the rest of the world. So while their critics downplay their success, their people are being taken care of despite the attacks. So, we've come to the best. Number 1, the universal champ, France. No matter what list you read, France always ranks among the top 10 and is at the top of many people's list. So while it's not perfect, their goal is to cover as many people as possible, including migrants, and they're committed to doing it well. The benefits are super generous, covering up to 80% of healthcare expenses, and the sicker you are, the less you pay, meaning no one's going bankrupt from having cancer. They cover every doctor, every hospital, every lab, so patients have complete freedom of choice. They're also covering everything from dental and mental health care to acupuncture and, get this, thermal spas. It's publicly funded with money coming from income and payroll taxes, and even off the sale of alcohol, cigarettes, soda, and the pharmaceutical industry. And get this, they live almost 5 years longer than we do in the US, with lower rehospitalization rates and lower infant mortality. Their system started out as private but changed in 1945. And although it's not government run, it's government financed. No insurance dictating here. There are no wait lists and no referrals. And even though it is expensive, it still costs half of what America pays out. How do they do it? Well, coverage starts at birth and lots of preventative care, which proves universal coverage can be the best, and the French are leading the way. So the next time an American politician says that universal health care just can't be done, that it's too expensive, it's just too hard, and it just won't work, you might just want to suggest they take a plane ride.
Later.